Welcome to the third installment of Total Body Blueprint. An integral component to any health and fitness plan is flexibility. All of us want to feel youthful and resilient, but oftentimes flexibility training gets tacked on the back end of our workout, with merely a couple stretches with a hold of a few seconds. Flexibility doesn't need to be some long, dragged-out process either, but an effort does have to be made on a consistent basis as the acute effects are transient. Devoting 10 minutes to each workout is sufficient for longer-lasting effects, and I'll show you how. The first part of any flexibility program is a warm-up. I like to refer to a rubber band analogy to understand why. If you pull a rubber band out of a cold glass of water and stretch it, what happens? It snaps. But if you warm up the rubber band by rubbing it against your palms for a while, then it becomes more pliable. Well, the same is true for your muscles and connective tissue. If you start stretching cold muscles, you're going to feel stiff and you can possibly cause a muscle strain. For this reason, only stretch muscles that are warm. So at the very least, begin your workout with a 3 to 5 minute general warm-up. On a piece of cardio equipment such as an incline on the treadmill, you can jump some rope, hop on the elliptical machine to get both the arms and legs pumping. This will raise your overall body temperature and warm up your joints, muscles, and connective tissue before training. Like the old adage goes, an ounce of prevention is worth a pound of cure. By warming up, you'll have several positive impacts on your performance. The muscles can contract and relax faster, there will be improvements in strength, power, and reaction time, and enhanced metabolic reactions that supply your muscles with energy also occur. Research suggests that a dynamic warm-up is even more effective than a general warm-up. You don't need any equipment for this either. They all involve using your own body weight. Using dynamic movements that are more functional, work through a greater range of motion in a variety of angles, allow you to better prepare your body for exercise. An example of this is a toy soldier march. Go ahead and try it. Lift your arms in the air straight out at shoulder height. Begin to move forward by kicking your legs straight up without bending the knee and toe pointed straight to the ceiling. Then set it down and alternate with the opposite leg, walking forward. You'll feel a stretch in your hamstrings as you do this and get an isometric contraction by holding your shoulders up at shoulder height. To watch a full video demonstration on how to perform this, go ahead and check out my FitRx YouTube channel. Other examples of dynamic warm-up movements are the lateral shuffle, giant arm and hip circles, arm and leg swings, uppercut punches, lateral bends and reaches, butt kickers, jumping jacks, seal jacks, and knee pulls. There are many, many more. I suggest doing a dynamic warm-up in substitution of a general warm-up for 5 minutes. After either a general or dynamic warm-up, you'll be prepared for a resistance training routine. By simply training through a full range of motion when performing exercises, you'll get a secondary benefit: increased flexibility. On the other hand, a limited range of motion will be detrimental to your elasticity. Also, be sure to develop all the major muscle groups we discussed in the last module in balance to prevent a loss of range of motion. The clients I've worked with that needed to omit stretching due to time constraints still experienced an increase in flexibility, which was an indirect outcome of being more active, training through a full range of motion, and targeting all the major muscle groups of the body. Of course, professional bodybuilders may limit their range of motion by carrying large muscle bulk and may impede joint mobility. But as mentioned in the second module of Total Body Blueprint, the concepts I'm advocating will not build this amount of muscle, nor does the FitRx program. Not only will you become more flexible when you're training with a comprehensive exercise program, your posture may improve too. Again, this stems from working the muscles synergistically. Many of us sit in our desks all day long, typing and staring at the computer screen. And this often leads to a rounded shoulder appearance with a forward head tilt. To combat this postural state, rowing movements need to be included into your workout routine. This acts as corrective exercise as you'll be performing shoulder retraction. You can also perform shoulder retraction without doing a row by using resistance bands and not bending the arms. This works just as well in shifting the shoulders and head back into alignment over time. When I've measured posture using software and specific markers before and after a prescribed exercise and stretch program, most clients have seen a dramatic difference in their posture by being consistent, at least 3 times per week for 12 weeks. A recurring question I get asked is, when should I stretch? The simplest answer is post-exercise, as your muscles will be warmer and the stretching will better facilitate range of motion improvements. Perform stretching within 5 to 10 minutes after you work out. If you stretch post-workout, you may also decrease delayed onset muscle soreness. ACSM recommends both pre- and post-workout stretching for older populations, people over 60. But if time permits in your schedule, I suggest doing some stretching prior to your workout regardless. Through my personal experience and clients' feedback, you'll feel more limber before the resistance training. Keep in mind that stretching should always be preceded by a thorough warm-up to allow for the increase in muscle temperature necessary for effective stretching. As a general guideline, stretch each muscle group a minimum of 2 times per week. There are several different types of stretching: static, both active and passive, ballistic, dynamic, and proprioreceptive neuromuscular facilitation, or PNF. What was that? I know, that's quite a mouthful of words. But PNF stretching is the most effective because it takes advantage of shutting off your proprioreceptors located within your muscles, which send feedback to your nervous system on how much a muscle is contracted or relaxed. These receptors save you from tearing your own muscles. PNF is best implemented with a partner. We'll get back to PNF stretching in a moment, but let's talk about the more basic stretching types first, as these are easiest to implement on your own and are still effective. There are 2 types of static stretches: passive and active. Passive stretching is when the body part is maneuvered into a position and held against a resistance barrier, requiring a partner, machine, object, wall, or floor to generate external force. Active stretching is when the muscles are contracted using the contraction of an opposing muscle group, rather than assistance from an external force. Both are effective, and you can utilize them simultaneously when stretching. For example, you can stretch your chest in a corner of a room with your arms bent, forearms pressed against the wall, and held perpendicular to the floor. Lean forward slightly and you'll feel the stretch in your pecs. This is a passive stretch. Now, if you keep your forearms against the wall and retract your shoulder blades while doing this, that's an active stretch, as you're contracting the opposing muscle groups of the chest, the rhomboids and teres major of the back to be exact. A static stretch is slow and constant, with the end position held for 20 to 30 seconds. When executing, move to the point in the range of motion where you experience a sense of mild discomfort. Keep in mind that several stretches are designed unilaterally and should be repeated on the opposite side, doing a stretch for the right and left quadricep, for example. You should decrease the intensity of the stretch if you experience pain or radiating symptoms, and use caution when stretching a hypermobile joint such as the shoulder. The next type of stretch is ballistic and typically involves active muscular effort in which the end position is not held. An example would be bending over to touch your toes and using a bouncing type movement to reach progressively further down. I usually have clients avoid this type of stretch as it's an advanced technique for athletes and can lead to a muscle pull. Remember the rubber band analogy? If you decide to implement ballistic stretching, it's crucial you are thoroughly warmed up. A dynamic stretch is a type of functional-based stretching exercise that we discuss with dynamic warm-ups. These type of movements are more specific to resistance training and better prepare the body for this type of activity. Arm swings are an illustration of this, swinging your arms horizontally from side to side, stretching your shoulders. Lateral lunges can be used to dynamically stretch your inner thighs. There's an abundance of these type of stretches, and you essentially get 2 benefits by warming up and stretching the muscles. Some guidelines to consider when performing dynamic stretches are to 1. Carry out 5 to 10 reps for each movement, either in place or over a given distance. 2. Progressively increase the range of motion on each repetition and increase the speed of motion on subsequent sets if appropriate. 3. Contract the muscles as you move through the range of motion. And 4. Move deliberately but without bouncing. Unlike ballistic stretches, the movement must be controlled at all times. The last type of stretch, and as I mentioned before is the most effective, is PNF. PNF stretching stimulates the Golgi tendon organs, a type of proprioreceptor. We call them GTOs for short, and they cause reflexive muscle relaxation. There are 3 types of PNF stretches. We're only going to examine one, as it takes advantage of both autogenic and reciprocal inhibition. Autogenic inhibition is accomplished through active contraction before a passive stretch of the same muscle. When I describe how to execute the stretch, this will make more sense. Reciprocal inhibition is accomplished by contracting the muscle opposing the muscle that is being passively stretched. This is essentially an active stretch, which we talked about. For these reasons, the most effective PNF stretch is the hold relax with agonist contraction. It has 3 phases. Let's use an example to illustrate. A partner stretching your hamstrings is assisting you. Lying on the floor, a partner assists you in stretching your hamstrings by raising one of your legs, straight with the knee locked, passively to the first resistance barrier, that point where you feel mild discomfort. You'll need to communicate this clearly with your partner. Your partner will hold this passive pre-stretch for 10 seconds, which is phase 1. Then your partner will ask you to push back against him with approximately 20% of your force. He'll resist your leg from coming down and no movement will occur during this isometric hold of 6 seconds, which is phase 2. Lastly, you'll be instructed to relax and he'll again apply a passive stretch as you simultaneously pull your leg back with a concentric contraction used to increase the stretch force for 30 seconds. This is phase 3. For this stretch, you'll pull your leg back using your hip flexors. During the 3rd phase, you'll instantly become more flexible and you see your leg move back to the second resistance barrier. It's really incredible and it works like magic. Phases 1 and 2 are essentially autogenic inhibition, and phase 3 is reciprocal inhibition. During this process, your GTOs are telling your muscles to relax. You can continue on in this fashion with another 6-second isometric contraction, followed by another 30 seconds of a passive stretch, otherwise you'll move on to the opposite leg. You can also perform this type of PNF stretch on your own by using a towel or a yoga band wrapped over your foot. To paint a clearer picture, check out me performing this PNF stretch on my FitRx YouTube channel. The last component to flexibility training is Myofacial Release, or foam rolling. It can be referred to as the poor man's massage, as it helps with relieving muscle knots and returning muscles to the optimal length. For those of you that don't know what a foam roller is, it's a long cylinder tube made out of foam, go figure. Some rollers are harder than others and therefore more intense to roll on. Foam rolling is best done after a general 3-minute warm-up or post-workout prior to stretching. You'll roll unilaterally on each side of your body as you'll be tighter in certain areas. Common areas to foam roll are your hamstrings, quadriceps, glutes, calves, inner thigh, IT band, and lats. The basic guideline is to roll at a cadence of 1 inch per second. Nice and easy. If you feel a spot that's really tight and sensitive, spots that make you want to cry when pressing on them, hold there for 30 to 90 seconds or until the sensation dissipates. By holding at those trigger points, the foam roller facilitates acupressure. I like to allocate 3 to 5 minutes to foam rolling each workout. You'll definitely feel a difference in mobility and move more fluidly. A tennis ball works great for myofascial release as well. With this simple apparatus, you can pinpoint certain areas and dig into those trigger points more easily, like the glute hamstring insertion, TFL, and other hip flexors. To view a demonstration on how to perform foam rolling and using the tennis ball, be sure to check out my FitRx YouTube channel. I show you the techniques and areas to concentrate on. Better yet, if you enroll in the FitRx program, I'll show you exactly how to integrate 30 minutes of flexibility training within the 3-hour per week fitness plan. The only thing really stopping you is your decision to do it. Between now and our next module of Total Body Blueprint on nutritional strategies, give foam rolling a 5 or 10 minute test run and take note of the difference you feel in flexibility.